I'll okay.
Okay, so it's recording now.
Yes. Okay.
All right. So when you purchase the first course, which is the Foundations of Medical Language, it automatically comes with the Intro to Medical Coding. So you will see an interface like this. You click on the right arrow. And you see the Foundations of Medical Language too. But a great starting point is the Intro to Medical Coding. So you come here, you click on Start Course. And the Intro to Medical Coding will give you a complete overview of all what the course is about. So you start with learning objectives. Pa, can you see learning objective on your screen?
Yes, please, I can.
Can you read what is under learning objective?
In this program, you will learn how to read patient medical records and apply ICD-10 CM diagnostic codes, HCPSC codes, and CPT procedural codes. You will also need to understand the role of the medical coder in the healthcare industry and how you will help ensure quality healthcare and reporting through quality coding.
Great. Can you explain what you just read to me?
Okay, so basically it's telling you what you are going to learn about and how you are going to apply it and understand how the healthcare coding system works.
Excellent.
The industry.
Excellent. So among the things you're going to learn about, the first one is you will learn how to read patients' medical record. Yeah. This is so important because, I mean, if you've ever been to the hospital, every patient that visits the hospital, there's a record kept on the patient. In Ghana, we call it the patient folder or the folder.
Okay.
In other jurisdictions, it's different names, but it comes back to the same one. It contains the history of the patient, the doctor's diagnosis, medication, procedures, and so on and so forth. Now, if you have ever taken that patient record, you'll notice that you cannot read it, or even if you are able to read, you don't understand what has been written.
Yes.
Is it correct? Is that correct?
Yes, it's correct.
If you're able to read what the doctors have written, you will not understand what.
Understand.
And there's a simple reason for it. The doctors, the healthcare workers use a language to communicate. That language is what we call the medical language. And it is the first course you will do. But in actual fact, that course runs across completely. Please, 1 second.
Yes, sir.
Hello, Pa.
It's not please.
Pa, are you with me? Hello, Pa. Pa, Kojo, can you hear me?
Yes, I can.
Excellent. I'm sorry, the interaction today is a weekend, and
Oh, I understand.
sorry about that. Okay, so in the healthcare setting, in the hospital, you have a language medical professionals, doctors, the nurses speak, and it's the medical language. You're going to start straight away learning that language for the rest of the program. Then you will also learn how to apply 3 sets of codes. The first one is ICD-10. The second one is HCPCS. The third one is CPT. Don't worry about what the codes are. You're going to have all the time learning about the codes. There are specific courses for each of them that you will take.
All right.
But ICD-10 is actually the 10th edition of ICD. So ICD has traveled from ICD-1 to ICD. In fact, today we have ICD-11.
Oh, okay.
We have ICD-11. And but we're currently, the whole world is gradually moving towards ICD-11. Now, ICD stands for International Classification of Diseases. International Classification of Diseases. And these are alphabet and numbers that are used to represent diseases, diagnosis, injuries, and a couple of things. They are developed by the WHO, the World Health Organization.
Okay.
They are developed by the WHO, the World Health Organization. And they are used in almost all UN countries. You know, the WHO is an arm of the United Nations, the health arm of the United Nations. So all WHO and UN member states are supposed to be using ICD. And not all of them are using them, especially like Ghana, Nigeria, a couple of African countries, and a couple of countries around the world are not using the full version of ICD. Okay. So, but other countries around the world, the US, Europe, they all use the ICD-10. ICD-10 has over 73,000 codes.
Wow.
73,000 codes, but you don't need to memorize a single one of them. Or there are softwares you use the find a code to look for them. I will show you how to do that shortly. Then we have HCPCS codes. HCPCS codes, these are codes for the services that are provided you in the hospital. When I say services, so when you go to the hospital, the first thing they do is they take your temperature, they take your BP, they develop a folder for you, they create a folder for you, the bed you sleep on, and every other thing that is resources of the hospital that is spent on you to take care of you have codes, and these codes are called HCPCS codes. Then, and by the way, there are just about 10,000 or 15,000 HCPCS codes. There isn't much of it. Then we have CPT codes. Now, CPT, current procedural terminology, these are codes for surgical procedures.
Okay.
Every surgical procedure on this planet Earth that can be performed on human beings has been coded.
Wow.
over 130,000 codes. ICD-10, ICD codes are codes for every possible disease you can think of on this planet Earth, in any part of anywhere in the world. Okay. So these codes have been developed, and the major purpose for the codes are resource allocation, and then reimbursement, insurance purposes. So the codes are developed by the medical coder, and the bill is prepared as a format you use and then sent to the insurance companies. Then they work through and pay the hospital for the service they have provided the patient. You will also understand the role of the medical coder in the healthcare industry. There are three critical roles of the medical coder. The first one is reimbursement. Without your code, the hospital can never be paid. Without the code you developed, the hospital, the clinic, and insurance companies, in fact, universities with hospitals, research institutions, they all use medical codes. Without your codes, it can never be paid, they cannot never get funding, and so on and so forth. Your codes, you are a pillar in the healthcare industry. Without your codes, there's no funding. Number two, you become the policeman in quote against insurance fraud.
Okay.
In the US and Europe, insurance fraud is a huge industry. It's more than $60 billion industry. Most doctors, most nurses, most healthcare workers are in on it. The commonest one, overcoding. So perhaps visit the hospital with a pain in the knee, and the doctor sees him and says, oh, everything is okay, give you some medication, you go away. Then behind you, they create a folder and claim that they provided surgery, complicated surgery for Pa. He was admitted for 30 days. He was administered this medication. He went to intensive care, all in a bid to blow up their insurance claims. Are you getting the picture?
Yes, I do.
You are going to fish out those fraud and stop it. And you are paid heavily for doing that. You also provide.
Are you fishing out the fraud because of the coding aspect of it?
Exactly.
How do you fish out the fraud?
Oh, Pa, you want me to teach you medical coding today?
No, I'm just
Let me give you an idea.
I'm just wondering how
is that
like basically
done?
how is that? Maybe
Okay.
put in some codes to pick out the differences or the discrepancies on the invoice that has been provided or something. I don't know. I'm just.
Okay, so you are thinking of invoices, I'm thinking of codes. Now, this is how it's done. Every hospital, to be reimbursed for the service, must prepare a bill for the insurance company. There is what you call overbilling. There's what you call unbundling. There are various strategies to report different codes that appears legitimate, other than the right codes representing representing the exact service that was provided for the patient.
Okay.
Now, in the coding world, there are rules to code. There are certain services that you must code once using one particular code. But at some point, there are two codes representing the same disease. Let me give you an example. There's a procedure and an endoscopic procedure called colonoscopy.
Okay.
Colonoscopy simply means putting a camera to look at what is in your colon, the large intestine.
Okay.
It's normally done with a tube, a long tube with a small camera inserted through the throat, through your mouth, through your throat, travel down your digestive system, through your stomach, and into your abdomen where your large intestine is.
Okay.
Or you can also do it through the anus or the rectum. Now, there's a code for colonoscopy.
Okay.
But there is another code for a doctor treating a patient bleeding as a result of colonoscopy.
Okay.
When it is done through the anus, when the tube is inserted through your anus and it goes into your large intestine, it normally happens. In most cases, the patient will go through some bleeding as a result.
Okay.
And the doctor must now treat that bleeding. Now, in coding, and for that matter, getting paid for treating the bleeding associated with colonoscopy. Once the rule is that when you code for colonoscopy, that is it. It is assumed you also treated the bleeding associated with the colonoscopy.
Okay. Okay.
Now, if you want to play smart, you present two sets of code, one for the colonoscopy procedure and the other for curing the bleeding.
Okay.
So you see what that will happen. You get double pay for the same.
Double pay.
And it is the duty of the coder to spot that and take out the double codes, so to speak. On the face of it, it's not a double code. There are two different codes for two different procedures.
Okay.
But you, the medical coder, with your knowledge of the rules, will advise the insurance company, no, you shouldn't pay for this. You take out that code, so on and so forth. No, you come and learn it. Okay. You come and learn it. Okay. Now, on the next page is program outline. Can you see program outline?
Yes, I can.
All right. And like I said, there are two rules to medical coding: outpatient medical coding and inpatient medical coding. The outpatient medical coding goes through all these programs: foundations of medical language, anatomy and disease, pharmacology, coding industry basics, health data management for outpatient coders, ICD-10, CPT, and ACPCS. Then you do the virtual internship before you write the final certification exams. So note, internship first before the exams, not the other way around.
Okay. Okay.
If you do inpatient medical coding program, you do the first 4 courses, same: foundations of medical language, anatomy and disease, pharmacology, coding industry basics. Then health data management for inpatient coders, ICD-10, inpatient and outpatient coding.
Outpatient.
When you come here, it's just ICD-10 outpatient coding. But when you come here, it's ICD-10 inpatient and outpatient coding.
Outpatient. Okay.
You do the same CPT and ACPCS, and you do one extra course that you only find in the inpatient coding course, which is ICD-10 PCS coding.
Okay.
Before you do your internship, the internship will cover both inpatient and outpatient. You are doing the internship, inpatient medical coding program. before you write the final exams. Now, after completing Model 5, then you start using the coding software. The find the code. Yes. Then system requirement. Can you please quickly read what is under system requirement for me?
Okay, so it says to make sure you are able to access all the information exercises and games, you will need to make sure your computer system is able to run the CareerWise program. You must use a Windows 10 and soon Windows 11 or Macintosh 10.15, Catalina or newer computer. We support the 2 latest major revisions of the following browsers: Google Chrome, Firefox, Edge, and Safari. This program runs best using Google Chrome or Firefox browsers. We do not support any version of Internet Explorer. This program is not supported on any mobile device. This includes all Android devices and all iOS devices. Sorry, no smartphone, iPhone, or tablet, iPad will be supported. Not even an iPad Pro, which is more powerful than many full-blown computers. Those electronic devices are insufficient for enrollment. When the training is complete, and the decision was made.
You mix it. Those electronic
devices are insufficient for employment when the training.
You said enrollment is employment.
Oh, okay. Employment, yes.
Yes.
When the training is complete and the decision was made not to support them during the training process.
Excellent. So it's self-explanatory.
Yes. So you can't sit one corner holding your phone or your tablet too.
Exactly. We are training you for work. When you finish, you'll start working.
Okay.
And in your work, you will not, the coding software you're going to use for your work is not based on it's not on iOS or Android. It is web-based only. It's a huge, powerful software. Let me show you that software. So I'm logging into my Find a Code page. Can you see Find a Code?
Yes, Find a Code, yes. Medical coding and billing made easy.
Yes. Then I click on my login. Okay, so that is some statistics I have used today. Now, this is just the interface. On the face of it, there's nothing extraordinary. It's just like a simple website. But let's go into it. So I want to find a code. When I come to codes, I have sets of code we call diagnostic codes. So these are ICD-10-CM, DRG, HCC, ICD-10, CM, DRG, HCC, ICD-11. Remember I told you we are now gradually moving towards ICD-11. Then SOMED CT, this is for radiology. And then we have ICD-9, the previous version of ICD before the coming on of ICD-10. Okay. So if I want to find a diagnostic code, say ICD-10, I come here, I click on codes, ICD-10 codes. It will open up to me to show me the various ICD-10 codes. You see ICD-10 diagnostic codes, and then you have code ranges from A00.0 to B99.9, certain infectious and parasitic diseases. Okay, so if I want to find a code for any disease, I come here. Let's say I'm looking for malaria. Okay, I have two options. I can come here and type in malaria, but there's also a quicker way of doing it. 1 second, let me show you. You will do what we call an index search, and it takes you straight to the code for malaria. Internet is a bit slow. So it's opening up. So basically, okay. So I come here, I type in, 1 second. Don't worry, we'll get there soon. Excellent. This page is called index search page. So I come here, I type in malaria. Once you begin to type, malaria automatically pops up. Have you seen it?
Yes.
Then you click on it. Then it shows you the code for malaria, certain infectious and parasitic disease. And these are protozoal diseases. This is a code for unspecified malaria.
Okay.
But there can be other forms of malaria, malaria with accidentally induced or therapeutically induced malaria. You can get a malaria as a result of taking a medication. It's not just mosquito bites that results in malaria. When there's malaria in the brain, cerebral malaria, there are different codes for it.
Wow.
When there are, malaria in a pregnant woman, malaria in accident, malaria in children, malaria, there are different types.
Wow.
And each of them has its own code. Have you seen it? Each of these has its own code.
Yes.
So let's come to our malaria. Our malaria is the tropical malaria, and that is Plasmodium falciparum malaria, unspecified. When you click on it, it will take you to a book view of the malaria. Okay, you click on the code itself, it will take you to this page. We call it the tabular list. And on the tabular list, you have the various permutations of the code and other detailed information, and most importantly, coding guidelines, the rules to use to code. So when I come to the coding guideline, you see, it tells me some critical information I need to take into consideration when I'm coding for malaria, Plasmodium falciparum. So you learn what all these terms means: includes, exclude, include, use additional code, exclude 1, exclude 2. They all have their meanings.
Okay.
Okay. So you don't need to memorize a single code. You have a coding software to guide you for that purpose. Okay. Now, a bit of, so that's just the background. Let me show you the first course you'll be doing, which is the Foundations of Medical Language. 1 second. Good. The Foundations of Medical Language is a 317 page you have to go through. It starts with some introduction, but majorly it starts with what we call the word structure, understanding medical terminologies, how medical terminologies are formed. Medical terminologies have root words, prefixes, and suffixes, each of them meaning something. Are you with me on this?
I'm here. I'm here, sir.
When you take the first one, antibiotic. It's a common medical term we all know. It's made up of 3 word parts. So anti, bio, and tick. Anti means against. Bio means life. Then IC means pertaining to.
Okay.
Okay. So we tell you what a root word, a prefix means, the root, another root word, medical term, orbital. Orbital. Orbit, the root word, R, suffix. So the root orbit means I. So in every medical term, when you see orbit, it means something to do with the eye, no matter how complex the word is. The suffix al means pertaining to. So orbital means pertaining to the eye. Another one, dermatosis. Ptosis means condition. Derm means skin. Anywhere you see the word derm, D-E-R-M, simply means the skin. So dermatosis means a condition of the skin. Then you begin to look at the big words. Megalocardia. Megalocardia. Made up of megal, O, card, IA. Now, mega simply means something big. O is a combining vowel. It doesn't add meaning to any word.
Okay.
It's only there to join two root names.
Roots. Okay.
And it can be O, or it's a vowel, so it can be any vowel. It can be A, O, U, I, E.
Okay.
Card means heart in medical terminology. Anywhere you see card or cardio, it means heart, as in cardiology. So, and then IA means pertaining to. So, megalocardia simply means a disease condition involves an enlargement of the heart or the swelling of the heart.
Okay.
Are you beginning to get it?
Yes, I am.
Enteritis. 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 Enter means kidney.
Oh, okay.
Itis means inflammation.
Okay.
So enteritis simply means inflammation of the kidney. Then you come to gastroenteritis. So gastro, enter. So 2 root words with a combining vowel, and then itis. Anywhere you see the word gastro means stomach. Enter means kidney. So gastroenteritis means a disease of or an inflammation of the stomach and the kidney.
Okay.
Urology. Anywhere you see uro means urinary system or urine. And then O is a combining verb. Logy means the study of. So urology simply means the study of the urinary system. Okay. Cardiomyopathy. Cardiomyopathy. Card or cardi means heart. O is a combining vowel. So you see a medical term with 2 combining vowels. It's because we are joining 3 different things, 2 root words and a suffix. Now, the root word card means heart. My or myo means muscles. Pathy means a disease or a condition. So cardiomyopathy simply means a disease or condition involving the muscles in the heart.
Okay.
You are getting the picture.
Yes.
So for each word, each of the part I explained. So party means disease, card means heart, mind means muscle. So disease of the heart. Cardiomyopathy refers to disease that affect the structures or functions of the heart muscle. At the end of each topic like this, you do a quick test to test your knowledge or understanding of what you have learned. Okay. And then you go on like that. Then you're going to learn a lot more combining forms and combining vowels. So you start from adeno, adreno, adenopathy, adenoma. What does it mean? Adreno, adrenopathy. Okay. Then when you are done, you do a test. Then you go to angio, arterio. Okay. And what they means. These are the combining vowels, like the beginning of or the main term in medical terminologies. And you see them combined with others. So, for example, angio. Angio is vessels. All vessels in the body are generally called angio. It can be blood vessels, it can be lymphatic vessels, it can be any vessel at all. A vessel is a pipe through which some liquid flow. The liquid can be water, it can be lymph, it can be blood, it can be anything. And they are generally called vessels. So, and the medical terminology for vessel is angio. Gram is also another combining form you come and learn later. Gram simply means a picture image. Okay, so when they do a CT scan, when they do an X-ray, the image that comes is a gram. So angiogram simply means an image of a vessel, or an X-ray image of a vessel, a CT scan image of a vessel, an MRI scan image of a vessel. Are you getting the picture?
Yes, I am.
So you go through all these medical terminologies, combining forms have been arranged in alphabetical order. So from A, you go to B, atro, broncho. From B, you go to C, casino, cardio. From C, you go to cephalo, cerebral. Then to D, at the end of each, you do a test, chondro, cranial. All of them means something. Then cyto, derma. So from D, you go to E, electroencephalo. So you go to course outline, you see how they have all been arranged. From E, you go to J, then H, L, all the way to V.
So by the time you're done, you become a doctor in your head.
Now, you are so right. This program is actually medical school online. So you're going to learn everything that doctor knows. Otherwise, you will not understand the doctor's diagnosis, the treatment regime, and so on and so forth. One of the commonest things you'll be doing is to correct doctors when they do wrong diagnosis.
Wow.
That's the fun part of medical coding. So medical coding is becoming a medical doctor without touching the blood.
Okay.
Yes, that's the side of medical coding. That is so interesting. Now, remember I told you this program we are giving you till we start working is just the beginning. When you finish your start working, you can continue and then specialize.
Okay.
Now, On your screen now are the various areas of medical specializations with corresponding medical coding specialization. Let me say that again. On your screen, you see a picture of the various medical specialization with corresponding medical coding specialization. So we have medical specialization as hepatology, the study of kidneys.
Okay.
Pediatrics, children.
Children.
Pneumology, anesthesiology, gynecology, endocrinology, dermatology, nephrology, oncology, neurology. As long cardiology, as wherever there is a medical specialty, there is a corresponding medical coding specialty. Okay. So we have gynecology. We also have gynecology medical coders. We have dermatology. Doctors specialize in skin, the nails, the hair. We also have gynecology medical coders. We have oncology. Doctors specialize in tumor and cancers. We also have gynecology medical coders. We call them cancer registrars. Endocrinology, cardiology, there are corresponding medical coding specialization. And when you specialize, that is where the big money flows. $100 an hour. Wow. Minimum. The highest paid medical coding specialists and oncologists, they earn a minimum of $150 an hour. So, right from the foundation, you will start learning the various medical coding specialties. You start by going through orthopedics. Orthopedics are doctors that specialize in bones. Okay. You're going to learn orthopedic combining forms. That's orthopedic terminologies. Orthopedic anatomy, bone function, bone growth, common orthopedic diseases, common orthopedic tests and diagnosis a doctor will do, common orthopedic surgical procedures doctors do, and then abbreviations used in orthopedics. Are you beginning to get the picture?
Yes.
So when you are done with orthopedic, you go to the next medical specialty. So you're going to work through all of them one after the other. When you finish orthopedics, the next one is cardiology. Cardiology, the study of the heart and the cardiovascular system. So you have cardiology combining forms, cardiovascular anatomy, cardiovascular function, common cardiology diseases, common cardiology tests and diagnosis, common cardiology procedures, surgical procedures a doctor will perform, and so on and so forth. Now, so what you said about by the time you are done with this, you become a small doctor on your own. You become a small doctor on your own. You are so right. Now, at the foundation level, not only are you learning the diseases, the tests, the signs and symptoms of those diseases, when you finish this course, the foundation, you will do another course. Let me show you. And that will even make you more happy. You will do a course called pharmacology. Pharmacology, 153 pages. Pharmacology will teach you, now you have learned the diseases of the various specialties, the medications to cure those diseases, the side effects of those medications, You learn them under pharmacology. So let's go to common diseases. Common disease, drug administration. Okay, pharmacology tests. Okay, so you do medications by body system. So medications for the head, medications for the neck, medications for the back, medications for the stomach, for the chest, for the entire body. You learn them. Okay. So pharmacology by all this body system, integumentary system, that's the skin, the hair, musculoskeletal system, respiratory, cardiovascular, lymphatic, digestive, endocrine, urinary, nervous, reproductive, sensory organs. By the time you finish this course, when somebody is ill in your home, in your family, you are able to administer at least basic first aid. Because you know exactly what you are doing. Okay. You know exactly.
So do the doctors do this as well? Do they also go through this coding?
We have doctors on the medical coding program as we speak. We have practicing doctors from Ghana and from other countries doing medical coding.
So it will be very easy for them because they are already accustomed to the terms.
That is the most amazing thing. Can you believe that today, top in our class is not a medical doctor? It's actually an IT person.
Wow.
The gentleman's course page I open it for a reason. Bid is an IT guy. This guy is an IT person. He's leading the class today. Wow. The next person after Bid, let me show you his course page. It's an interesting, it's a question we keep asking ourselves. We approach some of the doctors and we ask them, and some confess and said, you see, the course is a US program. And they have structured it in a way that makes the course slightly different from what they did in medical school in Ghana.
Oh.
Now, this lady, Mercy Esiedu, she is a nurse. She works at Komfo-Anokye Teaching Hospital. She is the second leader of the class. A nurse, not a doctor. Mercy Esiedu. The third person I want to show you is a district director of health services. Okay, so we have a variety of students, but for whatever reason, maybe the doctors are overwhelmed with the work they are doing and they are trying to add this already because most of those doctors are working doctors. These are practicing doctors and they go to work, they finish, they find time to come and do medical coding program. But trust me, they are lagging behind. Some also maybe complacency. Oh, I know this already. I've done this before. I will do it when I'm ready. This one, when I sit down one day, I will do it. Papa, papa, papa. That one day never comes. That one day never comes. The time they realize they are far behind, you know. So you are right. It's a medical program, but for some strange reason, the leaders of the program are actually not people with a health background.
Wow.
So, my brother, that is the picture. That is the picture. One of the practical things you'll be doing, the internship. Let me show you how the internship is structured. So you're going to work through clinical scenarios. And these are real world hospital records. So for example, this is cardiology, coding scenario 6. You have a patient name, age, male, the date of this patient visiting. So it's fresh, 18th November 2022. That is just yesterday.
Yesterday.
Okay. Now, indication, palpitations, medication, atenolol. So when you do, so you see medical terminology, pharmacology showing up already. Then procedure. The patient was monitored on a 3-channel ECG monitor for a period of 24 hours. Findings. Rhythm is sinus rhythm. Average heartbeat 73 beats per minute. Minimum heart rate 65 beats per minute, and so on and so forth. So you go on and on, and then the doctor's conclusion and his signs. And you, the coder, are to code this record. This is the part you're going to use to do the coding. This is the interface of a coding software that coders use in the hospital setup. Now, when you look at the outline, let me show you. So you start with cardiology, clinical scenarios. There are here 26 cardiology clinical scenarios. When you finish, you go to dermatology. Dermatology clinical scenarios. Okay. So from clinical scenario 1, Tony Asbury, 65, female, reason for appointment, sebaceous cyst excision. Very soon you understand everything that is written here. It is no longer going to sound gibberish to you. You know, so the detailed diagnosis by the doctor, test everything exactly as you see it in the health record. Detailed. And you, the coder, you must read and understand this and code it. That's not the only scenario. Look at dermatology scenario. Also, how many scenarios? Or 25. Then you go to family practice. Family practice also come with a number of scenarios. Okay. So family practice scenario. Also, that one is 30 scenarios. Then gastroenterology, general surgery, internal medicine, ops and gynecology, orthopedics, radiology, mixed specialty.
So that diagnosis for the diagnosis for the doctor. Yes. What is the coding? What is the coder arriving at?
The coder only takes
after using that information. What is it?
Okay, so when the coder picks this health record of this patient, he codes it, and the codes that he had developed will be used by another person called a biller, medical biller, to prepare the bill for this patient insurance company to pay the hospital for the work this doctor had done on the patient.
Okay. Okay. I understand.
Pa, do you have any question for me?
I'm fine. I understand.
Great. So this is the program. This is the program. Comprehensively done, so that when you are done, you work confidently as a medical coder for the rest of your life. So this is the course CPT and ACPCS procedural coding course. Teaches you all the codes under CPT and ACPCS. ICD-10 coding course. This is the biggest course you will do. It has 510 pages to go. Walk you through all the codes. Okay, I'm going to walk through all this using the Find the Code software. to find the codes. So, over to you. We are ready anytime you feel ready, sir.
Yes, sir.
Great.
Yes, sir. Yes, sir. Thank you very much.
Most welcome for your
Thank
time.
you very, very insightful.
Yes. Now, the reason why we brought...
I remember you said that the duration...
Go ahead.
Yes, I remember you said the duration was, like, assuming I'm starting now, by March, I should finish.
Yes.
Cool.
Yes. As you can see, the courses have been arranged in pages. And once you log in, you have access to it 24/7. So anytime you feel ready, I mean, anytime you just log in at your own convenience, at your own pace.
Oh, okay.
So
it depends on how fast you work.
Beautiful. How fast you work. If you can finish the whole thing in one day, you are done. If it could take you 6 months to finish, it's up to you. 10 years to finish, it's up to you. It's at your own pace. At your own pace and convenience.
So what's the, let's say, is it a pass mark?
Good.
The average?
You need to score for every course a minimum of 80%.
Okay.
80%, 80% for you to pass before you can progress to the next course. So let me show you this one. So you see this student, she had, this is 100% complete. Can you see it?
Yes.
And she scored an A. She's passed with 96% grade.
Okay.
I tell you, the leaders of the class, in the internship, she's 99% complete. She scored 94% grade. Foundation, 100%, she scored 98%. Now, there's a reason for this. You see, this is not, and I have to, let me explain this before you get scared away. On the course, there will be test assignment exams. Okay?
Okay.
And this test and assignment and exams, you take them as many times as you want. So if you do a test now, and let's say you scored 0 out of 5, you can retake it again and score another, get another score. Take it again, get another score.
Okay.
But our goal is, before you move to the next stage, you must score 100% on each test you do.
Okay.
When you do a test and you score 0, it means that the principles we want you to learn, the skill we want you to acquire, you have not been able to acquire. Go back, read it, learn it again, and come and do the test again. Okay. Do it as many times until you get the 100% score. Then we know you have acquired the skill.
Okay.
Now, so if you do the test, let's say 3 times, we're going to use your best grade to score you, not your worst grade. So you see, it is not an academic program. It's a skill oriented. We want you to acquire the knowledge and skill and be able to use it. So in this case, let me see. This lady had, they said, a 5 out of 5. Okay, normally they will not show you the number of times she had taken the test, but let me show you something. So she had taken this test already. Let me retake it again. I'm going to provide wrong answers. Let me get this correct, answer correct. And let me be sure I get this answer also correct. Yes. Then, oops. When you do the test, as soon as you do the test, you submit, and instantly it is graded. Have you seen? Can you see it?
Okay. Yes.
Instantly it's graded. So it says,
yes, I can.
I have scored 4 out of 5. Number of times taken 2. The last time you took this test, you scored 5 out of 5.
Okay.
Submission has been saved on the server.
Okay.
So even though now I score 4 out of 5, the system will still take the highest score.
The highest score.
Exactly. Okay, so that is how the test is. The final certification exams too, if you write and most likely your first attempt, you will fail. Most of our students, 2-3 times before they pass the final certification exams. Are you getting the picture?
Yes, yes, yes.
So the goal is an American education. The goal is not just acquiring knowledge, but using that knowledge, applying that knowledge. That is how the program is. So when you fail, you have not failed. It means you are not getting some concept right. Go relearn and come back and do it.
Yeah.
All right, bye.
Okay. Yes.
If you don't have any further question, I want to say thank you very much for your time. And we look forward for you to enroll as and when you feel ready. Anytime you feel ready, just enroll and start your course.